My name is Susan Houston. I'm the Vice President of Older Adult Services with Peninsula Family Service and a member of the Age Forward Coalition. Thank you so much for attending today to learn about the California Master Plan on Aging and how it benefits you. We have an exciting morning planned. Today, we will hear from our moderator, Maya Altman, about the Master Plan on Aging, and then she will introduce our panel of elected officials who will share how they will specifically support the goals of the Master Plan. This plan is important. We are living longer, as you all know, and many need support to survive or have a good quality of life. San Mateo County is also getting older. Thanks to the census, we know that our population of older adults is growing. 20% of San Mateo County residents are 65 and older. We have some housekeeping. Please note that all attendees will be muted during the presentation. Please submit any questions you have by selecting the Q&A icon on your toolbar. If you're calling in, please send your questions by email to info@ageforwardsmc.org. The final 10 minutes of our event are reserved for questions. We also have closed captioning. If you're interested, select the CC icon on your toolbar to enable subtitles. The Age Forward Coalition is comprised of a broad consortium of San Mateo County nonprofit and community organizations and advocates who have come together to address the growing needs of older adults. The coalition is committed to advocating for increased funding to maintain, protect, promote, and enhance services and support for people aged 60 and older, adults with disabilities, and their caregivers to ensure the highest possible attainment of independence, health, and well-being, and to make San Mateo County a more age and disability-friendly community for all. The event today is hosted by the Age Forward Coalition and supported by the SCAN Foundation and the California Collaborative of Long-Term Services and Supports. Here you see listed our leadership team who put this event together. And it was a lot of work, so kudos to all of them. Thank you. Now I would like to introduce our moderator, Maya Altman. Maya has been the CEO of the Health Plan of San Mateo since 2005. The Health Plan of San Mateo is a government-sponsored Medicaid managed care health plan serving approximately 134,000 San Mateo County residents. The Health Plan of San Mateo has initiated several innovative programs during her tenure. The Cal Medi Connect program, a federal state demonstration program for individuals eligible for both Medicaid and Medicare. The Community Care Settings program to help individuals living in nursing homes find housing and move back into the community. And the California Children's Services Demonstration, a program that serves children with severe illnesses or disabilities. In October of 2019, Ms. Altman was appointed by the governor's Stakeholder Advisory Committee for the Master Plan on Aging. Thank you so much for all of your work on this plan, Maya.
Okay, thank you, Susan. I'm very excited to be moderating this panel. I want to thank the Age Forward Coalition for inviting me, and also thank you so much to the elected officials who are participating today. As the CEO of HPSM, Health Plan of San Mateo, I've long been passionate about building better ways to provide services for older people and people with disabilities. And as you heard, I am a member of the Stakeholder Advisory Committee for the Master Plan. So we're in difficult times, but this may be a turning point for the communities we care about. First of all, this is the first master plan for aging that was called for, created, and endorsed by a California governor. He's highlighted these issues in ways never done before. COVID, the pandemic, is certainly a tragedy, but it's also cast a really harsh spotlight on problems facing our older residents. One major example, of course, are the problems in nursing home care. On the other hand, we have a new president who cares about this community, and that's evidenced by the American Rescue Act, which included a 10% bump, though it's temporary, for home and community-based services for older and disabled Americans. And President Biden's infrastructure proposal includes $400 billion for caregiving for all ages. So we certainly hope that gets enacted. And finally, today, the governor's May budget revise is released in about 25 minutes. We're all very anxious to see what kind of funding proposals, additional funding proposals there are for older Californians. All this resonates for those of us who live or work in San Mateo County. We are an older county, as you heard from Susan, and the older population is growing. So what is the master plan? What's in it? It's a 10-year plan. It puts forward 5 broad goals that are bold and far-reaching. Many of its recommendations will not be accomplished overnight or within a year or two, but that's okay because we have 10 years. It does include ideas for both the short, medium, and long-term action. And we certainly hope to see some immediate results. And the administration's January budget proposal did include several proposals for action now. And we hope and expect there'll be more in the May revise we'll see today. So the 5 broad goals are housing for all ages and stages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affording aging. The plan includes 23 overall strategies under these goals, more than 100 specific initiatives, and a dashboard, and this is really important, a dashboard to ensure everyone can monitor progress toward meeting the master plan goals over the next many years. Finally, the plan includes a local playbook or guide for how to support action in local areas. It's aimed at coalitions like Age Forward, which is sponsoring today's event. So here's some examples of strategies or initiatives contained in the plan. Increasing availability of integrated housing and health options, doing those together on one site, growing the geriatric workforce, innovating nursing home care. And this is certainly a long-term goal, but how can we develop smaller and more home-like settings for people who need nursing home care? There's a very strong focus in the master plan on dementia and Alzheimer's. Also in the master plan includes support for CalAIM, which is the governor's major Medicaid or Medi-Cal reform proposal. And through that, how do we serve people in new ways? So for example, enabling Medi-Cal plans like the Health Plan of San Mateo to continue finding alternatives for people who would otherwise be in a nursing home. The plan also has an initiative or a promise committing to pursue consideration of a universal LTSS benefit for people with middle incomes. Right now, only people on Medi-Cal have funding for long-term services and supports. And then finally, there's an emphasis in the plan on combating social isolation for older adults. As far as what's needed next, my opinion is, and I think the plan showcases this, today, the many programs and services that are targeted at older adults and people with disabilities are extremely fragmented and difficult to find. People right now need to fit into programs. The programs are not designed to serve the whole person and all their needs. We need to reduce the number of silos in state government, among programs and services, and across sectors such as housing and community living and health. The sectors tend to just focus too narrowly. In other words, we need to integrate services, programs, organization, and state government into a much tighter and more organized approach. It's not only about funding, though funding is extremely important, but it's also about a need to provide services in new ways. And finally, to accomplish the goals of the master plan, and I'm quoting from the leader of the SCAN Foundation, Dr. Sarita Mohanty, we need leadership, we need good policy, and we need better infrastructure for services. And we also need to help our leaders set priorities and make the investments to move those priorities forward. The issues laid out in the master plan are incredibly important to the residents of California. The SCAN Foundation recently surveyed public opinion in California, and there's absolutely no polarization around these issues. there's tremendous public support. So nearly 90% of the respondents said that it's important to have access to services needed to live at home and in the community. And a supermajority, that's 65%, said the pandemic has made it even more urgent to address issues impacting our aging population. Voters believe these issues should rise to the top of lawmakers' agendas. Nearly 8 in 10 voters believe the governor should prioritize and invest in the master plan, and nearly a supermajority, 63%, are more likely to support elected officials who prioritize the master plan for aging. More than 8 in 10 people say it is important for Alzheimer's disease to be a critical component of the master plan for aging. So the pollster, when he presented these findings, said, you know, these are unheard of figures. I mean, they just really, really high, very tremendous support for the master plan. So now's the time for action, especially on this day when the May revise is being released. I encourage everyone listening today to let their elected officials know what is important to them. And this is definitely your opportunity today. So let's introduce our distinguished speakers today. Senator Josh Becker is a public policy innovator working at the nexus of community activism, technology, and social justice. He's elected to the state Senate in November 2020. Senator Becker represents the residents of California's 13th Senate District, which comprises most of San Mateo County and the northern part of Santa Clara County. In 2000, he created Full Circle, a community leadership and policy innovation organization that funds nonprofits creating positive change in the Bay Area and building civic leaders for the future. Appointed by Governor Jerry Brown, Senator Becker served 7 years on the California State Workforce Development Board, and he served on the Child Care Partnership Council in San Mateo County. Speaker Pro Tem of the California State Assembly, Kevin Mullen, has represented San Mateo County since 2012. His legislative priorities have focused on election reform and democracy, housing and transportation, and clean energy. He has championed all vote-by-mail elections and was author of the landmark Disclose Act, which allows voters to easily see who is paying for political advertisements on TV and social media. Assemblymember Kevin Mullen has been a mayor and a council member in South San Francisco, a small business owner, television host, and commentator. He also served as an aide to his political mentors, Congresswoman Jackie Speier when she was a state legislator, and his father, former Assemblymember Gene Mullen. Assemblymember Mark Berman was first elected to the California State Assembly in November 2016 to represent the 24th District, which includes southern San Mateo County and northern Santa Clara County in the heart of Silicon Valley. Assemblymember Berman serves as chair of the Committee on Elections and Redistricting, where he's become a leading voice on protecting voters from deceptive election practices, making election information more accessible to voters, and improving election cybersecurity and campaign finance disclosure. Assemblymember Berman previously served on the Palo Alto City Council, where he was a leader on issues such as infrastructure improvements and financial transparency. Assemblymember Phil Ting was invited today, but he sends his regrets. He's actually in budget meetings this morning and cannot be here. President of the San Mateo County Board of Supervisors, David Canepa, was elected to San Mateo County Board of Supervisors in November 2016. He represents District 5, which includes the city of Brisbane, Broadmoor, Colma, city of Daly City, and parts of the city of San Bruno and South San Francisco. Supervisor Canepa served on the Daly City Council from 2008 through 2016 and served as mayor in 2014. His previous experience includes serving on the City County Association of Governments, or CCAG, I hope I'm saying that correctly, vice chair of the San Mateo County Transportation Authority, and a director for the Bay Area Quality Management District, representing 20 cities. As Supervisor Canepa continues to serve on the board of directors for the Bay Area Quality Management District and CCAG, he also serves on boards for the First 5 Commission, Health Plan of San Mateo County Medical Center, the Commission on Aging, Community Corrections Partnership, and the Association of Bay Area Governments. And last but certainly not least, Supervisor Don Horsley has devoted his life to public service in San Mateo County, from law enforcement in Daly City and East Palo Alto to elect a sheriff to an elected member of the Sequoia Healthcare District Board. Supervisor Horsley was elected to the San Mateo County Board of Supervisors for a third term in June 2018. He is proud to be the supervisor representing San Mateo County's 3rd District, an especially unique area along our gorgeous coast from Pacifica to the Santa Cruz County line. Supervisor Horsley served as the elected sheriff for nearly 14 years. During that time, he initiated and collaborated on several innovative programs to make our community safer. After leaving the sheriff's office, he was elected to the Sequoia Healthcare District, working to fund the North Fair Oaks Clinic and a community grant program. He also addressed school-based health programs in Sequoia Union High School District, Redwood City Elementary, San Carlos Elementary, and Belmont Redwood Shores, and more recently, ways to assist coastside residents with accessible primary health care. Supervisor Horsley has served on the HPSM governing board for nearly 12 years. So with that, we're going to start with Senator Becker. I think each speaker has about 8 minutes, give or take a minute or two. I'll try to keep people on schedule, and if I fail to do that, you'll hear a bell. So Senator Becker, I turn it over to you.
Well, great. Thank you. Thanks for having me here today, and thanks to the H Forward Coalition. As the newest member of the San Mateo County legislative delegation and Santa Clara County as well, having been elected recently, I'm very excited to be part of this program today and learn from all of you. I've been learning a lot from my colleagues, and Assemblyman Berman and Assemblymember Kevin Mullen have been terrific in helping me get up to speed on many issues. Again, it's just great to be here with all of you, and I look forward to hearing the rest of our speakers as well. A little bit about me. I'm from Menlo Park. I live with my wife, our 2 teenage kids. So I sometimes say I appreciate any thoughts, advice, or prayers that you have for me on that front. Having 2 teenagers during a global pandemic has been challenging, but we've also had some good times as well. My mom worked for the Philadelphia Geriatric Center for many years, and worked for a program called Counseling for Caregivers, for those, so counseling for those taking care of Alzheimer's patients. And so I have a familiarity with some of these issues from her, and she's actually out visiting. First time I've seen her in 15 months. She just got here late last night. So really very, very, very excited about that. Along the way, I've learned a lot, especially about the ways to be involved and to help our community. I founded a group called Full Circle. So for 20 years, we've done grant making in the Bay Area around education, economic opportunity, environment, and fourthly is health. And that, of course, touches on some of those issues here today. The development of the Master Plan on Aging was in process long before I was elected, but it's really fascinating to learn about it. I mean, one of the stats that really was jarring to me, really stuck out, is that we're going to be 30% of California's residents will be age 60 plus by 2030. So to paraphrase my friend, Board President Supervisor Canepa, who you'll hear from later, the golden wave or the silver tsunami, whatever you want to call it, is not coming. It's already here. And California has to find a way to support the welfare of our older adults. COVID has changed so much about how we live our lives. In my own life, for example, as again, I didn't get to see my mother in person for over a year, and I know it's affected so many, I'm sure, on this call, and being able to, keeping them from seeing loved ones. Maybe some of them, have experienced either, friends or relatives, who were taken from us by COVID. So it's affected so much, and it's shown our vulnerabilities, and it's shown the importance of a robust healthcare network and healthcare infrastructure in our counties and in our states. And it's also magnified some of the inequities and injustice that existed prior to COVID, and how vital adult day programs are, access to medical care, social support for older adults and support for caregivers are in everyday life. The 5 goals you mentioned are admirable and important. Housing for all stages and ages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affording aging. So I'll just speak for a minute about one of those last goals, the affording aging, which ties into a couple of the issues I mentioned I've focused on for a long time: economic mobility and empowerment. One of the things that some of our cities are exploring, including South San Francisco and Mountain View, is this notion of universal basic income. And it's a very intriguing idea. It's a program which, adult citizens would receive a set amount of money in order to alleviate poverty. Of course, we have Social Security. We have some other programs here for older adults. But one of the major issues many older adults encounter is support for those who are considered middle income. Right. So, middle income older adults who may not qualify for social service programs like Medi-Cal or CalFresh because they make, too much money, maybe because of a pension or home ownership, where they own a home, but they don't have a lot of current income, means many of them might still not have enough money for medications or from food. And I think we really saw that. The Great Plates program was a great success in the sense that it helped a lot of these older adults, but it also showed that there's many senior homeowners in our area who are house rich, but cash poor, and are struggling in many cases to fund, as I mentioned, their medicines and in some cases food, as we've seen, here during the last year. So, how much would it help to have that kind of program, maybe universal basic income or another program for seniors in excess of the qualifications at the SSI, which basically require you to be at poverty level. So there's something that has to be done here, I believe, for those who are not at poverty level, but still are in need. And we need to come up with some fresh ideas, shall we say, around that. We are really excited for the May revise. As I remind my colleagues, when I was elected, we were projecting a $50 billion deficit, and now we're projecting a $75 billion surplus. So, of course, I take credit for that. No, I'm kidding, but I'm really fortunate to be at this time where we do have a very substantial surplus, and it's a great opportunity, but also an incredible responsibility for all of us to make sure that money is used wisely. And there's a lot that could be done. So just a few last ideas, and I'll turn it over. Increasing hourly pay statewide for in-house supportive services workers, the IHSS workers. That's one idea. Providing a livable wage, time off, and benefits to anyone caring for a child or for older adult at home. As you mentioned, as Maya mentioned, we've seen how the Biden administration has focused on caregiving as so essential to our economy. Caregiving for the youngest, and also for older adults.
Yes, that does bring us down to item 15A. This is Veronica.
Medi-Cal reimbursement rates, so that more physicians will see Medi-Cal patients. So, we have a lot of possibilities. We need to think creatively and quickly with this stimulus that we have, the surplus that we have. So I look forward to hearing from all of you today, learning more about the challenges and opportunities. I look forward to hearing from my colleagues, and thank you again for having me.
Okay. Thank you, Senator Becker. I'm really glad you mentioned inequity and having to address the inequities throughout the state, because that was very much a focus in the master plan too. We try to look at everything we propose through an equity lens. So thank you for that. Next, we're going to hear from Assemblymember Mullen.
Thank you so much, Maya. Wonderful to be with you. Great to see my legislative colleagues. Let me also say, as the father of twin toddlers who are running around, You may not see them in the background, but I can hear them outside. I too ask for your prayers. But wonderful to be with this whole crew today to talk about something as important as the California Master Plan on Aging. As Maya and Josh indicated, we are anxiously awaiting the release of the governor's revision. And I'm just struck by just what an extraordinary opportunity this is to be actually sitting on money. I have hopefully 3 years left in the assembly and was expecting that we'd be managing debt for the next, for at least the foreseeable future, but to be in a surplus position like this is an extraordinary opportunity to actually put some funding to this plan. The planning has created a structure. Now we need to come through with some financing to make the master plan a reality. But great to be with all of you to talk about the plan. It has brought issues of great importance to the table, such as healthcare, caring for loved ones from a distance, social supports, and preventing isolation, especially for those with disabilities, and providing means of economic security at a time of anxiety and financial strain. According to the Department of Finance, older adults 50 and plus are the fastest growing age group experiencing homelessness, often for the first time in their lives, many of whom live just one crisis away from being homeless. And even though California has more multi-generational households than any other state, due in large part to high housing costs, financial constraints, care needs, and cultural preferences, there are still 1.8 million older adults who live alone. By the year 2030, 1 out of every 4 Californians will be age 60 plus. That adds up to nearly 11 million people that will be 60 plus. Given that California has the second highest average life expectancy in the nation at almost 82 years, we need to plan and act now. Make some serious changes in the way we support and provide for older adults. These sobering statistics are part of the reason why I have a legislative package that focuses on affordable housing as well as climate and disaster preparedness and resiliency planning. I believe the foundational infrastructure in our state is affordable housing, and my Senate colleague touched on that as well. Without a safe place to call home, everything else suffers. So these priorities coincide with the California Master Plan for Aging's first goal, which is housing for all ages and stages. At the risk of stating the obvious, California is in a dire need of housing, and even more so affordable housing, which is crucial for our seniors that do not own their own home. When California had what were called redevelopment agencies at the time, I'm sure many folks on the call remember the use of those redevelopment agencies. We were able to use RDA effectively when I was on the city council in South San Francisco to build affordable housing. We lost that chief source of affordable housing. One of the quirks around the RDA law, the agency was required to record covenants on the property that would guarantee that those units would remain affordable at below market rates for 30 years, and in some instances 50 years. At the time, there was sort of a projection that at some point here these will become due, and we're going to have to deal with that. Well, that time has come. As those time limits expire, the unit may then be leased at market rate. As each unit resets to market rate, that is one less affordable unit that is available to a low-income household. So in order to keep those units affordable, I introduced AB 1029 this year, which asked the California Department of Housing and Community Development to add preservation of affordable units to their list of priorities for allocation of state funding. So certainly we need to build more affordable units, but we also need to be preserving what we already have. I just want to touch briefly on climate and disaster readiness for our communities. Related to the housing goal is climate and disaster readiness of communities. AB 1500 is the Climate Bond Act of 2022. I'm co-authoring with my colleague, Eduardo Garcia. California needs a comprehensive investment strategy to prepare for and adapt to climate change's impacts on the state's public health, agriculture, disadvantaged and coastal communities, forests, economy, infrastructure, and waterways. So this is a $7 billion bond. It is a little strange to be talking about a debt instrument when we're sitting on this very large surplus, but I actually think there are some investments that can be made in the short run with this budget and the budget surplus that we're going to have hopefully for a couple of years, bond financing for some longer term projects that we need to invest in. And then the third B there, budget bond, I'm saying is Biden, which is the new administration in Washington. And we talked about the $400 billion for the care infrastructure. There's also going to be large dollars coming from the federal government to deal with climate resiliency. So it's an incredible moment we have in front of us. So if approved in 2022, that longer term plan, proceeds of bonds would go to wildfire risk reduction, protection of coasts, bays, and oceans from sea level rise, safe drinking water, drought preparation, and flood protection to help fish and wildlife adapt to climate change and protect California's residents and regions from extreme heat events. Not so much an issue in San Mateo County, but extreme heat is a major issue in large swaths of California. So we're hoping to fund a number of projects, as I indicated, in the current budget year as well. Just a couple of other bills I want to touch on very briefly. I know my time is somewhat limited, but AB 435 and AB 168 both advocate on behalf of the hearing impaired. I'm not sure if you know this, but I do wear hearing aids. I don't have them on now. I've got the headphones on, but I understand the struggle and the need for better technologies and integration of services for those with hearing loss. So in times of emergency and disaster, whether personal or widespread, those with a disability such as hearing loss need effective communication to reach authorities and loved ones. AB 435 will strengthen hearing aid consumers' ability to understand prior to purchasing a hearing aid if it contains proprietary software that cannot be repaired or adjusted at a different hearing aid retailer than where it was originally purchased. Essentially, it's a good consumer bill. We hope that has some success. And then in 2019, I had AB 1168, which became law. It requires the Office of Emergency Services to implement a text to 911 and real-time text service to all counties by 2021, so the deaf and hard of hearing have equal access to emergency services when they don't have access to TTYs or computer modems. And finally, I'll wrap with talking about some of the district activities. And I do want to give a shout out to Virginia Kroger, who not only prepared me for this panel, but is very involved in working with our senior community. We put some events on called the Senior Scam Stopper in partnership with the Contractor State Licensing Board to empower older adults to avoid abuse and exploitation. It used to be called Seniors on the Move. It's now On the Move, and that's Jackie Spears Conference. Proud to partner with her as well as Carol Groom at the county level. And then Senior Care and Life Planning seminars highlighting the importance of advanced care planning and securing healthcare options for whether in the hospital or at home, including hospice and end-of-life care. And my last note will just be a personal one. I've learned the importance of the programs and support available to older adults. My father, who, as you know, recently passed away, was able to stay at home and be cared for as he wished in his final days. As a caregiver, I was able to spend quality time with him at the very most important time. Hospice care provided privacy, the resources and comfort of his own home, and time with his family. So it's important that these options are available for all seniors. So with that, let me just thank everyone for being here today. We have to put this master plan, take it from a planning stage into actual funded work and implementation. I certainly hope the improved budget situation will help with that. But honored to be with all of you to share a few of my thoughts, and looking forward to hearing from the other panelists, my good legislative colleagues, and Maya and everyone at the Age 4 Coalition. Thanks so much for the opportunity.
Okay, thank you, Assembly Member. I'm sorry for your loss of your father. I knew him, worked with him when he was in the legislature, and he was always very kind and, you know, a great supporter of the health plan, and really had deep appreciation for all he did.
Thank you.
Thank you. Okay, so I think now we're going to turn to Assemblymember Berman, and you know, we do have a little bit more time, so I would say, you know, 8 or 9 minutes is okay. So I don't want to force you to rush when we do have a little more time.
Thank you, Maya, and good morning. It's dangerous to tell a politician that they have more time, but I promise to use it judiciously. Really, it's a pleasure to be here, and especially with my legislative colleagues. It's always hard to follow Senator Becker and Assemblymember Mullen, who covered such a great breadth of issues. I'll touch upon some of those issues and also some new ones, but between Senator Becker, Senator Wiener, Assemblymember Mullen, and Ting, San Mateo County is well represented in Sacramento, and so it's really a pleasure to work with all of my legislative colleagues. I think, and this has been touched upon already, but I think that perhaps the biggest issue that many in the Bay Area will face as they grow older or are facing right now as they're retired is the issue of affordable and accessible housing that will allow people to age in place. My district includes some of the richest zip codes in our state, but also some of the zip codes with the greatest need. And aging in California, the reality is that unfortunately it isn't an option for many who live here now, working hard to serve the communities that they will not be able to retire. And one of the memories, one of the deepest, kind of strongest memories I have from my campaign back in 2016 was talking with some nurses who had lived here, worked here, served members of the community their entire careers, and were retiring and were forced to move far away from Silicon Valley because of the cost of living and the fact that they couldn't afford to live here on their retirement savings. These are people who dedicated their lives to serving us, but all of a sudden couldn't continue to live in the communities that they'd served their entire career. I think that's a shame. And I think it's really an indication of an unhealthy kind of balance that we have here in Silicon Valley. As we know, our cost of living is too high and our affordable housing options are too few. And when you add long-term care to the mix, aging in place becomes prohibitively expensive for too many Californians. I'm a huge supporter of ramping up affordable housing production in our state and focusing on housing that's accessible and located within walking distance of shopping options and services. I think the pandemic has given us an opportunity to think a little differently about how we want to live and thrive in the future. Our lives have changed so much in the last 15 months. We have meetings online, we get food delivered, or we get takeout, which I do far too often. We adapted to limits on how many people could be in grocery stores. We social distance to keep one another safe. Last year, in reaction to the pandemic and in an effort to keep Californians safe, I introduced AB 860, which was a bill that required county elections officials to mail a ballot to every active registered California voter for the general election. And I actually got the inspiration for that bill from watching the primary in Wisconsin in the middle of 2020. I don't remember or I don't know if anybody else remembers, but this was soon after COVID hit. And there were video on the news of seniors sitting in chairs, moving the chairs every couple of minutes for a mile. I mean, they were waiting in line for hours just to vote, just to do their civic duty. But the situation in Wisconsin forced them to go in person, which was a health risk and really threatened the lives of millions of people. So I believe that keeping people safe, especially our seniors who were at elevated risk from COVID, and allowing them to vote from the safety of their own home was critical to our democracy. Last November, 71%, almost 71% of eligible California voters cast a ballot in the presidential election, which was more than any year since 1952. And it was clear to me that the changes that we made were successful in making it easier for eligible voters to cast their ballot, which only strengthens our democracy, which is why this year I've introduced AB 37, which seeks to make many of the changes that were critical to last year's success permanent. If passed, AB 37 will ensure that Californians can vote in the manner that's easiest for them, and will ensure that all Californians have the ability to track their ballot through the voting process using the Where's My Ballot service. Another bill that some of you might care about is AB 390, which I introduced this year to make it easier for Californians to cancel online subscriptions that they no longer want or use. And I kind of want to see, I'm not going to, if we were in person, I'd say, give me a show of hands of how many people have tried to cancel something online and not been able to because they run you through 50 different hurdles and you give up. before you ever actually reach the stage of confirming that you canceled the subscription. So at a time when millions of people are struggling to recover financially from the COVID-19 pandemic and subsequent economic slowdown, many of us are searching for ways to save money for simple necessities such as groceries and rent. And one potential option for those cost savings is to cancel the subscriptions for goods and services that we rarely or never use. Unfortunately, there are too many businesses that use a variety of tactics to make canceling subscriptions inconvenient, confusing, time-consuming, or otherwise difficult. During these challenging times, it's especially important that consumers can easily cancel subscriptions that they may no longer be able to afford. And AB 390 would make it easier to cancel online subscriptions without having to jump through inconvenient or impossible hoops, and would ensure that Californians are better informed about when and how much they are being charged for services. Because oftentimes you might sign up for something and then forget, and then they don't send you any sort of notification, and then the charge just shows up on your credit card and it's too late. We should get a notice 10, 15, 30 days before we're going to get charged, so that we have the option to cancel it if we want to. So I'll close with that. I don't want to take up too much time, but again, thank you so much for having this event today. And ensuring that we remember to be mindful about the needs of California's aging population as we craft legislation. And like my colleague said, I'm very excited about funding the master plan for aging, and look forward to, I think the governor's press conference might have started a few minutes ago. Look forward to hopefully hearing that he's putting real money behind that really good plan. Thank you so much.
Okay, thank you very much, Assemblymember Berman. I'm struck by, and it's not surprising, but it's clearly a theme that's running through everyone's remarks is the theme of affordable housing. People can't age in place and avoid nursing homes if they don't have a place to live. It's just, it's a huge challenge, but clearly it's just one of the top issues we face in the state. So Supervisor Canepa, you're up next.
Thank you. I would like to thank the Age Forward Coalition for asking me to speak this morning. I would also like to thank Maya Altman, the CEO of the Health Plan of San Mateo, for her endless hours working on the committee in creating this plan that I think will be monumental. I think it's a perfect time to talk about the master plan for aging, especially since the month of May is Older Americans Month and is a time to honor the contributions and aspirations of the county's rapidly growing aging population. By the year 2030 in San Mateo County, 1 out of 4 residents will be over the age of 65. The number of adults over 65 will increase by 72%. I'm encouraged to see that Governor Newsom has developed a master plan for aging and is really focusing on how we can improve the quality of life in the state of California. I will touch on the 5 goals mentioned in this master plan and talk a little bit about how San Mateo County has addressed some of the important factors mentioned in these goals and how we can also improve in those areas. So goal 1, the housing for all stages and ages. It's important that people can age in their own communities. Population projections show adults over the age of 65 will more than double by 2060. Keeping this in mind, we need to work toward increasing housing options for this age group. Housing affordability impacts many of our residents across San Mateo County. About 47% of San Mateo County residents, many more than 30% of their income to rent, and 64% of the population 65 and over pays this percentage. As longevity increases, affordable housing and other services will be in much higher demand. The good news is that there are more affordable senior housing projects being completed around the county. This helps create healthy, stable homes for our low-income seniors. In the fiscal year 2019-2020, we spent about $21.5 million toward affordable housing and homelessness. Overall, the county's Affordable Housing Fund, together with its Preservation Fund, have allocated over $120 million to assist supporting development of affordable units. In my district, we have put money aside toward the reconstruction of Midway Village in Daly City. We take 100 units of apartments and will build 500 units of completely affordable housing, which will also have a community center and a new park. In addition, Colma's Veteran Village is a new affordable community serving low-income veterans. This is a 66 apartment, which include communal space and a garden. In addition, I had the privilege to work with Bernie Mellott from the Ombudsman Program to develop an eviction program for current residents of residential care facilities for the elderly in San Mateo County. This program used CARE Act funds to pay delinquent rent payments for individuals who fell behind on rent between March 2020 and January 2021. Within 7 weeks, we successfully identified 18 individuals who are behind on their rent, and they were issued payments. That total came to approximately $460,000. These relief funds limited the risk of eviction, which provided solace to individuals as well as their loved ones. Goal 2, health reimagined and caregiving that works. I'm fortunate to serve as a board member of the Health Plan of San Mateo and serve as the liaison to the Commission on Aging. Access to health care for all ages and incomes is essential. I'm hoping we can receive funding at the state level to really help our San Mateo County older residents stay in their homes and receive health care where they are more comfortable. Many older adults who are middle income and covered by Medicare only still can't afford home and community health services. We need to look at how we can integrate and coordinate care between health plans, hospitals, and community organizations in serving older adults in order to improve health outcomes. Goal 3, inclusion and equity, not isolation. As we get older, it's vital that we all see a purpose in life. This may be through work, volunteer opportunities, cultural and faith-based activities, and civic engagement options, just to mention a few. My office works with a subcommittee from the Commission on Aging in identifying agencies that provide employment training and job placements for adults. In addition, they're looking at scheduling a community forum for older adults that provide information about senior employment. With COVID-19, many things have changed for job search services. There are San Mateo County resource centers that offer employment assistance services throughout the county. They're in Daly City, Belmont, and Redway City. We must remember, in order to access these services, people need digital access. In addition, internet access connects us to information, services, and even each other. I am proud to say that San Mateo County really is focused on this category related to the Age-Friendly Initiative. We have been able to utilize Measure K funds to certify 6 of our 20 cities in San Mateo County in becoming age-friendly. And we, in conjunction with CAFE, are currently working with 3 additional cities this year. I think San Mateo County really is starting to look at ensuring all our cities in the entire county becomes designated as age-friendly. As I've mentioned before, and Senator Becker mentioned, there's a reference to the silver tsunami. I look at it as the golden wave. San Mateo County has been committed to supporting older adults as they take charge of their health, explore new opportunities and activities, and focus on independence. This is an area I would like to see funding dedicated for all cities to become age-friendly, in addition to helping cities develop action plans that are developed and implemented for years to come. This is just not a one-time deal. It's a continual awareness of our city's needs. Goal 5, affording aging. We are too familiar with the expensive costs of living in the Bay Area. California has the second highest rate of poverty among older adults in the country, and we've seen an increased amount of homelessness and food insecurity amongst our elders. The federal poverty level is unfair to California, especially considering the state is among 13 that sends more tax money to Washington, D.C. than it gets back in federal spending. The FPL does not work for California and many other states. It's time for the federal government to take serious action on this matter, or our aging population will find itself in a nearly unsolvable crisis. In 2011, 62% of San Mateo seniors were considered the hidden poor. Middle income seniors have too many financial assets to qualify for Medi-Cal, but often do not have enough resources to cover housing and support needs as their health and functional well-being changes as they age. I think this master plan for aging will look at the whole person and design a system for delivering comprehensive care and community-based infrastructure and resources. We are fortunate to have the Middle Income Senior Opportunities Committee that is looking at ways to help find alternatives to assist older adults in educating them regarding resources that may help them feel a little more at ease. This may be through food insecurity, employment options, and emergency preparedness. A prime example of this is the Great Plates program that was implemented during the pandemic. It was a resource for people who didn't qualify for county programs, but still couldn't afford food. The county has worked with aging adult services and with more than 60 partners to deliver over 4 million meals to 4,513 older adults in San Mateo County, provided by 84 restaurants. With this program, we have infused $51 million back into restaurants, into our local economy. This is a perfect way for older people to access food. Getting older shouldn't be considered a bad thing, but should be considered as another phase of life where interests and dreams can be pursued. We need to work in partnership on how we can collaborate with our legislators at the federal, state, and local levels, in addition to our partnership with our CBOs in providing the best life possible for those entering the golden age. Let's make sure it's not silver. Let's make sure it's golden. Thank you so much, Maya, for the opportunity.
Thank you very much, Supervisor Canepa. Yeah, Great Plates in San Mateo has been a tremendous success, and I really thank the Board of Supervisors for really pushing that program. And I just wanted to remark also that the age-friendly initiative, the Age-Friendly Cities Initiative, which you have advocated for so strongly, was a major recommendation in the master plan as well, that it be adopted by all cities in California. And then finally, the Medicare only population, people who are, especially for people who are middle income, we really tried to focus many recommendations on that population, and of interest, and looking forward to seeing more in the governor's May revise, is we push for the establishment of a Medicare Medicaid Innovation Office at the state level. They can really do research and think about ways that we can leverage Medicare because there are a lot of possibilities there, but leverage it in better ways for our citizens here in California. So thank you for your remarks.
There are a couple of questions in the chat. Should we?
Yeah, that would be great. Yes.
All right. So the one question that we have here, it says, with the rampant crimes in California, personal and property safety has unfortunately become the utmost concern, especially for seniors. Please address this pressing issue. Why catch and release? Don't know which of our elected leaders would like to tackle that question.
I'm happy to take a first crack. And, I think crime has definitely become a big problem. Some of the policies that have changed in California have been voted on by voters, which have been through propositions. I believe it's propositions 47 and 57. Don't quote me on the numbers because there are too many propositions in California. But that's been a statement and a decision that the voters have made at the ballot box over the past couple of years. But I do believe that, as a state, we went far too far towards the tough on crime kind of strategy of the 80s and 90s, and far too far away from smart on crime. And we were locking up too many people for too long, for frankly, who weren't violent threats to the community. And I was talking with somebody yesterday, actually, whose brother-in-law had gone to prison in Northern California, was able to get a degree was able to get training, I should say, skilled training in the trades, in the building trades. And when he got out, he got a job, he's got a house, he's got a family, and he's a constructive member of society. And that's because we focused on the rehabilitative side of the corrections and rehabilitation department. And so it is a fine line. I am also concerned about the rise in crime, and especially property crimes that we've seen throughout California. It's tough to find that balance between policies that are locking people away for too long unnecessarily versus policies that don't disincentivize people from committing crimes. And so I hear you. I might even agree, depending on what the suggested proposals are, to kind of make sure that people take seriously the fact that committing a crime has consequences. It's something we'll keep working on.
Mm-hmm. And so sadly, recently, we've seen an escalation in crimes against older Asian adults, which is just deplorable. So definitely something that needs to be looked at in the future.
And if I can just quickly on that note, that's a huge concern. It's disgusting. It's deplorable. And there are multiple bills moving through the legislative process this year to target hate crimes that have been occurring for years, but obviously the awful crimes against our API brothers and sisters, and especially elder API residents, has really rightfully gotten a lot of people's attention. I'm also curious to see Senator Becker and I and Senator Wiener are members of the Jewish Legislative Caucus in the legislature, and our top priority was $50 million in the state budget for nonprofit security grants, which are grants that would go to community organizations, senior organizations, synagogues, churches, mosques, LGBTQ centers, you name it, so that they can put in place the security that they feel that they need to make sure that all of their members feel safe. And so I'm curious to see if the governor hopefully funds that priority in the budget that he's talking about right now. So it's a big problem, absolutely.
Thank you very much. So there is another few questions have come in. Do you see any possibility that San Mateo County might be included in legislation proposing pilot programs for nursing home innovation and caregiver workforce development?
So this is Kevin. Thank you, Tom, for the question. I think that's going to require a little bit of follow-up with regard to the specific pilot program. What I would say, though, is San Mateo County, given the work of the Age Forward Coalition, the fact that San Mateo County is the most aging county in California, I think we still have that distinction, if I'm not mistaken, that we actually are probably positioned well to look at that in terms of the nursing home issue. And then workforce development, I believe Senator Becker's still on the call. I first actually met Senator Becker. We both served on the Workforce Development Board of California. So we can I still serve on that, actually representing the speaker. So we can look at the workforce development piece with regard to caregivers. But Tom, if you'll allow us, I think I'll take that and see if we can do some staff follow-up for you to get you some specifics. But thank you for raising the issue.
Very good, thank you. So the next question is acknowledging, first of all, starts off acknowledging all of the great work that has been done by the elected officials, but is asking more specifically about what resources and how much funding will be committed this budget cycle and over the next 10 years to ensure that we meet the master plan for aging goals. And one particular issue that's come up is that in San Mateo County, we have the Measure K funds. And even though the older adult population is according to the latest demographics that came out, almost 20% of the San Mateo County population, only 3% of Measure K funds are allocated for programs that support seniors. So perhaps one of the supervisors would like to talk about how nonprofits and community-based organizations and other organizations that serve the older population can access more Measure K funds so that it can be spread more equitably across the age continuum.
Yeah, thank you. So
Sandra,
much. I'll take that question.
Supervisor, I'll let you take that.
Great, thank you so much.
I apologize.
No problem.
If I could just interrupt real quick. Sorry about that, Supervisor. I have to run. We had a scheduling snafu on my side. And so I have another meeting that started a minute ago. But just really want to thank everybody for having me. And you're in great hands with the supervisors and my colleague, Assemblymember Mullen. So great to see everybody. Thank you so much.
Yeah.
Can I interrupt you again? I'm sorry, Dave.
No, sorry, Don. Go ahead. I shouldn't
interrupt him, but I'm going to let him speak first. But I had to drop off because I had to go to the Coastal Commission. And so they had to testify at the Coastal Commission. I finished my testimony, so I'm back on. So in any case, if David wants to go first on Measure K.
No, go ahead, Don. Go ahead.
I think that's a fair point, except that, one of the things that we focused on when we're running Measure K wasn't on senior services. What we told the public is that we were really focusing on affordable housing. So it would be kind of disingenuous to the voters for us to turn around and say, gee, we're not going to do affordable housing. We're going to spend it all on, senior care. But we sort of we recognize, and I just want from my own life experience, much like, Kevin and his departed father, who was really the stalwart of San Mateo County and somebody that all of us admired and loved. He learned that about being able to stay in his own home. And that's some of the things that we have supported. For example, the IHSS program. Cities will sometimes brag about, minimum wage of $15 an hour. We did it a long time ago. We made sure that our over 7,000 IHSS workers earn more than the minimum wage, and that they have medical benefits as well through the health plan of San Mateo. In addition to that, we do fund the Ombudsman program, but we recognize at the same time that there are needs, for example, like respite care for seniors who perhaps in a hospital for a period of time and need to come out and have to have some place to go. And I know that our health plan and all the hospitals have worked on that. And of course we do, and all of our core agencies are available to assist. And I don't know that they, make a decision or give us information based on the age of whoever they assist, but the assistance is that we provide for everything from food to rent to utilities is open to all age groups, of everyone who is in need. And so I'm guessing that the senior population takes more advantage of that than the 3% number that you're indicating. There probably more can be done. I had the unfortunate experience was my father died many years ago, but my mom and his stepfather both required assisted living. My mother had Alzheimer's, and so I'm really aware of how difficult it is, how expensive it is. And I'm also really grateful for my Ombudsman program to making sure that when I couldn't be there, I knew that there was somebody that had their eyes on the facility. So I think the county does, a really good job, an excellent job. That's not to say that we couldn't do better. With that, David.
All right, thank you, Vice President Horsley. I think Don covered a lot of key points. One thing, we look at the Measure K funds and, revenue, usually, it's about $90 million. And so we talk about, senior carve-outs. One of the things, well, there's several things that we've done and we've gone big on. I mean, obviously, making the investment in age-friendly cities, working in partnership with Peninsula Family Services, and making sure that our older Americans can get to, whether it's getting groceries, whether it's getting their nails done, whatever it is, Those sort of mobility issues are game changers. And so, I already highlighted how we were able to use those dollars to stop those people who are actually living in senior homes, RCFEs, from being evicted. And I think the board is acutely focused on senior issues. And we always forget about a big issue. And that was the closure of Seton Hospital. That would have just had an adverse effect on North San Mateo County, and the county, because of what we've done, and then with the health plan of San Mateo, that really created an opportunity for the new buyer to gain confidence and to acquire the hospital. And so, one of the things we always forget about too, and the San Mateo Medical Center does incredible work for our older Americans in terms of the care they give. And as you know, as the budget for the county is appropriated, the health department is the recipient of a huge amount of those dollars. And so the county remains committed to our older Americans. Don had referenced how we doubled down, and rightfully so, on the affordable housing piece, which I think is just, the worst thing that could happen, and I've seen it, is that when older Americans, they're living on fixed incomes, and then they tap out because they don't have the basics to get by. And I think the housing component for us is going to be the driver in making sure that the people who raise their kids in these communities, or people who lived in these communities, that they're able to stay there with us. And then let me just close by this. San Mateo County has hired a chief equity officer. Her name is Shireen. This is really dynamic in so many ways. She's going to be working with different departments. San Mateo County is probably one of the most diverse counties in the area, but really just making sure that when we're looking at these issues, that we're really taking an equity lens. And so the county remains committed and focused, and looking forward to really continuing the conversation and providing the funding that nonprofits as well as others may need. So
let me add one more thing. David's not really taking a lot of credit that he deserves on Seton Hospital, because he was really the driving force. He was, and Seton Hospital is important for senior for a couple of reasons. One is the senior, it's Seton Coastside has seniors. I think the total number is about 116 beds for basically skilled nursing for seniors. Although I assume some people who require that kind of care might have been in a somewhat younger, for example, might be have been involved in a serious auto accident and require skilled nursing, maybe even on a permanent basis. But the hospital also has a skilled nursing unit. So the amount of money that we've spent kind of propping up Seton is I think in excess of $40 million. And that is it's a resource for the northern part of the county that wouldn't otherwise exist. And they provide significant care for senior citizens. So I think that's sort of a real credit to Supervisor Canepa's really dedication to his district and his community. And it's also helped mine as well, because the Seton Coastside is on the coast side, and it's the only emergency room that we have on the coast side.
Vice President, thank you so much, because if it wasn't for Don, and his leadership, it could have been much, much more difficult. So thank you for all you do.
Thanks, David.
So there is another question here about the need, whether or not you see a need for San Mateo County's IHSS wages to keep pace with San Francisco and the other Bay Area counties.
What does San Francisco pay? You know?
Nope.
I'm not really sure. I know that, well, I know that it's at least $16 or $17 an hour. And I also know that we provide healthcare through the health plan. I don't know what San Francisco does. And I did hear earlier that the state with the bounty is talking about increasing wages for IHSS workers. So perhaps that will occur with the state. But, you know, one of the other point I was going to make about the state is that, you know, we've this whole pandemic has really decimated lower income people. We all know that. And we know that people are really desperate and concerned about being evicted. And at the same time, the state has a $75 billion surplus. What it really shows is the disparity between upper income people who have really done quite well during this pandemic, but lower income people have not. And so our hope is that the governor, in his wisdom, will do things to help that small businesses, people like the IHSS workers. And I am sure that Senator Kevin Mullen will have a major role to play in nudging the governor to make some appropriate investments in our people.
Don, if I could just, Supervisor, if I could just pick up on that. Thank you for tossing that my way just a little bit. There's no question that, you know, you mentioned the higher income earners. The $75 billion surplus is actually indicative of the incredible volatility we have in our tax structure. Yeah. And the reliance really on higher income earners and the capital gains and the stock market. And it really is a boom bust budget cycle we have in California. We actually, as good as this news is, it's actually indicative of a sort of larger problem in terms of how we do taxes in California. So maybe a topic for another day. But in terms of IHSS, home care workers, I think what you're seeing out of the federal government is extraordinary, looking at caregiving as human infrastructure. And we at the state level, we're going to be pushing for long neglected increases in a variety of programs. I've been an advocate for the intellectual and developmental disabilities community. There was a rate study that, you know, the wages and the funding for the program does not take into account cost of living properly. And as we all know, the cost of living is extraordinary in San Mateo County and the Bay Area. The problem is this surplus is really viewed as a one-time surge of money because of some unique factors in the pandemic. When you're pushing for increases in formulas, you're sort of building that in for a number of years. And I just know the governor, the Department of Finance, they resist those ongoing costs. They prefer one-time allocations. But my way of thinking is, if we can't at least engage in this conversation in a meaningful way about lower wage caregivers, when can we do it? If we're sitting on a $75 billion surplus, half of that though will go to Prop 98 and replenishing the rainy day fund, but you're still talking about $35 billion to work with in addition to the federal money. So all of these things have been neglected for years and years and years. This is the time to make those investments in people. And if we can't do it in a year like this, when can we do it? So when so many people are hurting coming out of this pandemic. So we are there in spirit, Supervisor. The question will be is how we negotiate this over the next number of weeks here and what kinds of increases we can get for the most vulnerable, for the most needy, and the people that care for them.
Very good. So this is another question that may be somewhat technical and may need a follow-up answer from somebody later on. It's about board and care facilities that are in San Mateo County. Apparently there's only 1 or 2 board and care facilities that participate in the assisted living Medi-Cal waiver program. And are there plans to expand and add more funds to this assisted living waiver program in the master plan? Because apparently now the wait time is over 1 year to get into one of these facilities. And so can someone comment on why San Mateo County does not have as many board and care facilities participating in the waiver program as might be needed?
If you don't mind, I can actually try to address that question. The assisted living waiver program has a lot of requirements for board and care homes, and that scares some of them off. But I do want to mention an alternative to that. If you know people that would qualify for the assisted living program, you believe they would qualify, they should contact the Health Plan of San Mateo, because we have a program that is also going to be included in CalAIM, the Medi-Cal reform initiative, where we can pay for someone to live in an assisted living facility and bypass the waiting list for the assisted living waiver. So I can't answer why, if the state is going to put more funding into the assisted living waiver, I don't know. But there are alternatives in San Mateo County for people on Medi-Cal or people on Medi-Cal and Medicare, and please urge them to contact us if they feel they need that service.
Thank you, Maya. There's another question here about Sutter Health that recently closed the Senior Focus Day program. So that was an adult day health service program that provides medical services to individuals who need a higher level of care and provides great care respite. There were only 2 of these adult day health care programs in San Mateo County, one here on the coast and one Senior Focus over the hill. And this adult day health service program, Senior Focus, was recently closed. Sutter Health also closed some other programs that they had that provided care and support for older adults and their families. So I don't know if any of the elected leaders have an answer to, these programs were so essential, and my understanding that it was because of a lack of funding that they weren't able to stay open. So I wonder if you have any comments about that.
Well, if you don't mind, I can broach that question. Maybe others will chime in. Yes, Sutter was subsidizing Senior Focus, and with the difficulties in the pandemic, and they've had some financial setbacks. They decided to no longer subsidize that program. Believe me, we advocated very strongly with Sutter to please not close it. It is a very important program, but we weren't successful. The good news, though, is that we have been working with a potential operator of a new program who wants to restart up something like Senior Focus in San Mateo County. And they have an excellent reputation, and they're looking for a site right now. So if anybody knows of a potential site, they should let us know. And Supervisor Pine's office has been working with us and with that operator as well. So hopefully we'll have a resurgence of that program in the next few months.
Thank you. I'm just scrolling in to see the questions are coming in thick and fast. Let me focus on this one. So given that middle income seniors, which was definitely a topic that a number of the elected officials spoke about today, given that middle income seniors do not qualify for programs like IHSS, are there specific plans and designated funding that can support these seniors and their family caregivers? How can we enhance the home and community-based services that allow people to remain at home? It would seem like Measure K dollars would be ideally suited to improve local services. So I think that the elected leaders certainly acknowledge that the middle income seniors are a particularly high risk group, but can you maybe provide some more specifics about how you would support this group of individuals?
So there was a Measure K reference there. I'll defer to my county colleagues on that particular piece of it. I would just say I'm not able to specifically answer the question, but let me try with this. The middle income folks, lower middle income earners, have obviously a particularly tough time in a high cost area like San Mateo County. A number of programs are formula based and they take sort of a one size fits all approach across California. We have been fighting, this is all the way back to Jackie Spear when she was in the state legislature, representing this area, to advocate for these high cost areas that get left out of funding, because we talk about the pockets of poverty we talk about the pockets of need. And the question was about middle income earners, but really it speaks to the issue around affordability and the affordability crisis we have that is particularly pronounced in San Mateo County and the Bay Area. This is an ongoing project of my legislative colleagues, not only from the area, but really from the Bay Area wide, because we all hail from pretty high cost areas, to add definitions in the code around what are called under-resourced communities. Without getting too far into the weeds here, the reality is when a lot of funding goes to disadvantaged communities, as defined disadvantaged communities, that leaves out a quote unquote wealthy area like San Mateo County. But we all know there are people that are struggling here. There are people that are struggling to make rent, and it's particularly challenging for middle income, lower income folks in our county. So this is like an ongoing project that not only touches the service programs you're referring to, it's a range of programs that get funded in government. So we are acutely aware of this challenge and are continuing to work on it, and frankly getting creative in ways to add definitions to formulas that actually open the door for funding that might not normally have been the case. So I hope that wasn't too jargony, but it actually is very important work if we can accomplish some of the things that my colleagues and I are advocating for.
If I might add that, just on a personal note, that it is really, for the middle income people, really isn't a whole lot. So for one, I mean, I sort of have the lived experience with my mother and stepfather. Mom developed Alzheimer's. Stepfather was also a diminished capacity, and both of them had to go into assisted living. And essentially, how we did it is we sold everything they had, and it kept them for a number of years until they passed away. It essentially bankrupted them. But I just, you know, there was no other way around it. And there weren't, and there aren't programs necessarily help people like my mother and stepfather. It would be nice because they both were Medicare, it would be nice if Medicare would have had a benefit similar to Medi-Cal, taking care of people in skilled nursing, but it just didn't exist.
I just wanted to chime in real quick. There is some great work that's been done the last couple of years. A lot of people who are really thoughtful on this issue and have met as a committee, and that's the Middle Income Seniors Opportunity Committees. And they've, they've been formulating recommendations, working extraordinarily hard to see how to address these issues. And so the question was specifically, relative to the county's piece is, Measure K. And I think what we do as a board, and there's a lot of different interests around Measure K. Typically what we do is we set priorities, but maybe, moving forward is really just taking the opportunity to work with the Middle Income Seniors Opportunities Committee to really understand sort of what their recommendations are. And then from there, as you know, funding is pivotal and critical. So I know myself, being the president of the board and being on the board of supervisors, are willing to have that conversation and to see, maybe probably not this cycle, but in the next cycle, seeing what we can do to address that issue, funding cycle.
And if I may add too, I don't think the Measure K isn't enough money. There isn't enough money locally to address this issue. It has to be really needs to be a federal response, but a combined federal state response. There is a recommendation in the master plan for a middle income long-term services supports insurance benefit. The state of Washington has adopted such a benefit. It's one of the longer term recommendations, but if you're interested, there is an organization, it's a coalition of advocates for older adults and people with disabilities called CADA that's been working on this for a couple of years. They convinced the state to do an actuarial study. And so it is something that people are advocating for. And really that's the either that, or as Supervisor Horsley suggested, if Medicare had a benefit. I think those are the pathways to resolve this problem. It's a huge problem.
And there are ways around it and getting, well, for example, I'd had some advice, an advisor tell me that all I had to do is essentially have my mother deed everything over to her children and put her into the position of being essentially incomeless and put her into Medi-Cal. And perhaps some people do that kind of thing, but I just always felt that, it was their money, and, my mom and stepfather, is their money, and it should be available for them to take care of them in a place that was comfortable for them. And so I made sure that, they were my mom loved to dance, so they had a place that had music and dancing. But so, yeah, I think the only way is to have some kind of an insurance policy, or if Medicare extends the benefit for assisted living, that I think that ultimately is the only way to do it. So, for example, in my case, it was costing for two parents in a facility $10,000 a month. So you can give one person $100,000, but what about everybody else? So it's you just can't do it with local tax money.
Excellent. So I see that we are almost approaching the end of our time. We do still have a few questions that have remained unanswered. And so what we can perhaps do is put together a one-pager, give elected leaders an opportunity to provide any more input if they would like to. And then we can send that out to individuals who were registered to attend the meeting today. And so the one last question that I would like to answer is that if anybody's interested in joining the Age Forward Coalition of San Mateo County that has put this panel discussion on, then our contact information is on the screen, info@ageforwardsmc.org, and we would love to work with organizations and individuals who would like to continue to advocate for funding for older adults. It's such an important part of our lives. And so now I think I'm going to turn back the reins to Susan Houston to close us out, but I want to just quickly say a personal thank you so much to our elected leaders and to everybody for being here. I've had a wonderful day, so thank you. Susan?
Yeah, I also have had a wonderful day. This has been amazing. Thank you so much. A big thank you to Maya and all of our elected officials. I'm really impressed with these great ideas that have come up. Some of them that I wrote down: the universal basic income to alleviate poverty, increasing pay for IHSS workers and caregivers, really putting investments in the people, of course, all of the affordable housing, which we really need to continue to find affordable housing for older adults, integrate and coordinate care between hospitals and community organization, care transition types of programs. Great work from Supervisor Canepa on the age-friendly initiative and the development of action plans. I look forward to that in the future. The federal poverty levels, revamping those, assisting middle-income older adults, bills to target hate crimes, really a lot of wonderful ideas. Thank you so much for everyone who attended today, and to our wonderful panel and Maya. Thank you.